Hello, I'm Dr. James Carraway, the Director of the Plastic and Cosmetic Surgery Center of Eastern Virginia Medical School. I'm a plastic surgeon, and we also have a skincare center. We do laser treatments as well as other types of skincare treatments. Today we're going to demonstrate the eco2 laser, which is very user-friendly, gives good results, and the patient acceptance rate of this treatment is high. We have found it to be a very useful tool for rejuvenation of facial skin because it has the newer technology of fractionated CO2. You can vary the power and you can vary the density of the small beams. It's good for hyperchromias, it's good for fine lines, it's good for thin skin where you hope to thicken the underlying collagen because the CO2 of fractionated laser goes into the dermis well and treats the dermis. We've had a good time with this laser because it is user-friendly, and this I think is a very important point. It's so easy that you can train your nurse technician to do these treatments while you're doing surgery or other things. The laser has two modes. One is the static and one is dynamic. The static mode is like a stamp pattern. The dynamic pattern is like a moving pattern which goes everywhere that the laser touches. So if you have the stamp pattern, you then use the dynamic mode to blend in the edges of the stamp pattern. The end result is a better, more homogeneous blending of the laser pattern on the face. This is Blair. She's a 70-year-old woman who had a facelift 5 months ago. The eco2 laser for Blair offers us the opportunity to go into the deep dermis and remodel her collagen while changing the skin pigmentation and the texture of the skin. It will improve the quality of her skin, and it will make a real change in the aging of her skin. We're going to put some topical anesthetic cream, and we're going to give her an injection of Versed intramuscularly into the lateral thigh, about 3 milligrams. And this will help her relax for the procedure along with the topical anesthetic. We give xylocaine 5% topical ointment or BLT cream, but leave it on for about 30 to 40 minutes. First thing that we do is to take the ointment off, and then we begin treatment with the handpiece with the laser. Basically, we have a choice in this patient of how much power to use and how much density to use. Here you see a setting of 110 joules and 100 density to go in the static mode to be used around the face and cheek areas. Then we go to the dynamic mode where we change to 100 hertz and 100 density and use this over the total overall face and use that to blend in all the static treatments which have been done. The handpiece can be set so that you can actually fire off the static mode with a foot pedal, or you can do it automatically as it approaches the skin. It will not fire until it touches the skin. You'll see that the patient acceptance of this treatment is very high and discomfort is minimal. We like the laser, the eco2 laser, very much. Call Lutronic, get a demonstration. You really need to see it and at least give it a chance because it's a great unit to use. This is the best, I'll tell you. It really is.